for poor GMP. For decades together, our UIP program consisted only of 6 vaccines. 1/3 of the global unhumanized children, unfortunately, hail from India. Take a look at the budget, and I've put constant dollars here. This is in terms of the total health budget for the fiscal 2011-12, which will end soon. The total health budget was $523.6 million. Look at the amount that has been allocated to the routine immunization program. From $13.8 million in 2009-10, for some inexplicable reason, it's actually dropped down to $11.4 million in 11-10. $11.4 million for a nation with 1.2 billion population. This amounts, like I said, to 2.1% of the health budget. Compare it to the $1 trillion economy that India has. Don't bother to do the math. It goes into 0.0001%. I have stolen this slide from Dr. Khera at a presentation he made a couple of months ago, which talks about the immunization coverage in India. If you look at the 3 central states, those are states which have the largest population in India and unfortunately the lowest immunization levels. These are states with a 40% immunization level. However, among this chart is also a shining example further south in Tamil Nadu. Here is one state that has been remarkable in the immunization program that it has undertaken. So in this backdrop, let's look at the vaccine policy, which sets out its overarching aim as the goal of vaccine is to reduce morbidity and mortality due to vaccine preventable diseases. It is really, 34 years ago that we had the expanded program on immunization. 26 years later, we now have a vaccine policy, which is a commendable effort because at one point now you have a framework that looks at all the aspects that impact the immunization program. So a couple of quick comments which would lead on to our discussion. One, first of all, though it's a vaccine policy, it is focused entirely on the universal immunization program. So per se, it is an immunization policy, not a vaccine policy for the industry as a whole. Perhaps this is something when you consider that 90% of the vaccines procured for the immunization program are from the domestic industry, perhaps greater effort or the policy could have dealt with the issues that besiege the domestic manufacturers. The key issues that the policy touches upon, and something that we'll discuss very shortly: procurement, the role of public sector units, implementation issues, financing aspects, surveillance and decision support systems, and of course, research and development. There seems to be a them versus us syndrome in the vaccine industry with the government and the private players on one side, which is strange when you consider that how each is dependent on the other. Again, we have the L1 kind of policy procurement, and it is very difficult to fathom how any funds at all will be left for R&D for domestic manufacturers. We have this revival business always going on in India, and we are talking about revival of public sector units. I think we need to take a hard look at what really is the role of public sector units. Are they an insurance against stockouts? Will they manufacture orphan products? How will you ever capitalize? Every one of these public sector units is loss-making. Have you forgotten what happened to, right here in Hyderabad, Indian Drugs and Pharmaceuticals, HAL, and a host of other entities? Again, how do you bring about synchronicity? There's so many departments that are working, state, central, and other regulatory bodies. Ultimately, has the time come to have one centralized agency for vaccine, which will be empowered, then as opposed to having multiple departments which are functioning at this point in time. Finally, like in everything else and all good policies, the bottom line lies in implementation. The vaccine policy looks at a number of initiatives, and these are just a few that I've jotted down. It talks about setting up a grand challenge fund, the mapping of research capacity and its network, paper, the setting up of a sophisticated analytical instrumentation facility. It talks about setting up of biorepositories, a financial sustainable plan, and of course an interagency task force. It of course begs the question that who's going to do this? And more importantly, when are we going to do this? So like in most things, the competitive difference, like Larry Bossidy said, is not in deciding what to do, but really on how to do it. Execution obviously becomes paramount. So with this backdrop, I don't know if we'll come up with recommendations, but we certainly will ask the right questions. Thanks so much. Regular production and supply of vaccines in a setting where the majority of manufacturers are increasingly paying attention to newer vaccines is a big challenge. So what the policy is trying to suggest that there is a capacity shortage for vaccines of the universal immunization program. Do you agree with this, Dave?
It's safe to say I completely disagree because first of all, I don't think there's a capacity bottleneck just in terms of how much vaccine is being produced in the country and how much they're using. DTP tends to be the dictator of the cohort of vaccines. 3 doses, approximately 26 million children, and then wastages. Typically, India buys about 100 million doses of vaccine. You have at least 5 manufacturers in this country that have upwards of 100 million doses as their individual capacities. So they're able to not just supply this country with the vaccines they need, but through the UNICEF mechanism and others, they're supplying vaccines to over 140 countries. So I think there's no question about there being a capacity bottleneck. Perhaps this alludes to a capacity bottleneck specific to the public institutes, which does exist. India historically, both public and private institutes had a great role to play in actual delivery of vaccines. No one was individually responsible for that, but I think if you take the public institutes alone, that's possibly a challenge that they're alluding to. But I would argue as an industry, we have absolutely no capacity bottlenecks. For newer vaccines, of course, it's a different story.
So if I could push you a bit on this, you're saying there's no capacity problem as far as the industry is concerned. So if there is no capacity issues, is there some problem with the procurement process there? Why isn't the government able to procure adequate number of vaccines in time?
I think this is a very important issue, and the issue of procurement is not something that India struggles alone with. I think many countries and systems have struggled with the right procurement practices, across the board. And the problem with procurement is twofold. One is, for vaccine manufacturing, you need to make sure there's sustainability of supply. So supply security is one aspect of procurement, and affordability is the other aspect. You need to make sure that you have most competitive prices and so on. The Indian procurement practices are geared towards affordability. They do not currently ensure supply security. And I say this at the cost of our company benefiting from this strategy for many years, but it simply does not ensure the citizens of this country supply security for vaccines. And why that essential dichotomy exists is for a number of reasons. I think that when you want to ensure supplier security, you need to make sure that you encourage multiple suppliers in the market. So essentially, you trade off, in the short term, you trade off potentially different price points of vaccine, but therefore you ensure that you're encouraging multiple suppliers. Now this is very hard to explain in a system that only allows for L1 tendering and so on. This of course is worsened by the fact that the procurement practices are not standardized, and I will allude to this if we do talk about the public versus private institutes. But essentially, public institutes, the vaccine institutes in India receive preferential treatment, grants and aid, and subsidies. I was rather shocked. I said, look, when we all operate with the same kind of costs and so on, our GMP levels are different. Why should there be this whole business about affordability? We should all be able to compete. And I was shocked at the point where I realized that actually these institutes do receive multiple subsidies. So, I always I liken this to the airline industry and draw a lot of parallels, especially in India, with the airline industry. And a lot of people appreciate this because it's received so much press attention. But what you end up doing is you create an Air India, you give it subsidies, and if you create a monopolistic situation, then it's worse because you stifle innovation. And in vaccines, I don't know about airlines, but in vaccines you need innovation. And then you create just such an unhealthy marketplace that you sort of drive innovation.